Hello, everyone. We have with us Dr. Matuja. She's a specialist obstetrics and gynecology and minimal access surgery at the Rene Medicity, Cochin. And she's here to talk to all of us about one of the very common uh, lifestyle related disease, which is PCOD, which there are many aspects to it. I had once read a very appalling statistics that in urban India, in cities, around 40 to 50% of the women have either PCOD or hypothyroidism, according to a recent report. Multiple factors, including lifestyle, many aspects get into there. And let's talk about PCOD, which is of course on rise. What all are the things which needs to be done to manage PCOD through a lifestyle perspective and also from a clinical perspective from the eyes of a doctor. Thank you, Dr. Madhuja, for agreeing to this. Wonderful to have you here. Welcome. Right.
Thank you for inviting me, Rajiv.
Right. So we'll start with the most common question. Could you explain what exactly is PCOD and PCOS, and how does one person understand that a person is having PCOD?
Yeah. At the outset, let me just tell you that polycystic ovary is different from PCOS or polycystic ovarian syndrome. So polycystic ovary is basically the appearance of ovary on an ultrasound. That is, it has multiple, follicles that have failed to grow and mature into an ovulatory egg. So that may or may not be associated with symptoms. So when it is associated with multiple symptoms, that is when we call it as polycystic ovarian syndrome or PCOS. So there are a lot of people that come with the scan report saying that, doctor, I have PCOD, what do I do about it? So let me just tell you that every polycystic ovarian appearance on the ultrasound doesn't need to be treated. Only when it is associated with multiple symptoms, that is when you need to treat the syndrome. So it is basically an endocrine disorder which has multiple symptoms. That is, a patient can have menstrual irregularities. That is the most common complaint people come to us with. And she can have infertility, she can have excess weight gain, obesity, and lot of hormonal changes that cause change in her physical appearance. So she can have excess of acne or excess of hair in unwanted areas of the body. And also it is related to something called insulin resistant features. So that is a person can have darkening around the neck or the underarm area. So those are the main features that we see in a patient who has insulin resistance also. So we diagnose this with specific criterion. That is, in an adolescent and in an adult patient, it is different. The way we diagnose it is very different. So in an adolescent patient, we don't give importance to the ultrasound finding because around 50 to 60% of adolescent girls will have polycystic ovarian features on an ultrasound, but they may or may not have symptoms. So in an adolescent patient, if she comes with menstrual irregularities, say 2 years after her menarche, and if she has excess of acne, excess of hair in her unwanted areas, and also excess weight gain, that is when we diagnose PCOS. And in an adult patient, any of these symptoms with or without ultrasound findings is when we call it as PCOS.
Right. So is it hereditary in nature? Is this hereditary in nature?
See, that is not the only reason why somebody can have PCOS. But yeah, if your mother or aunt or your sister has had PCOS, then you are more likely to have polycystic ovary.
Right. So how does PCOD affect fertility, and is it possible to conceive if a person is having PCOS?
Yeah. So a person with PCOS may or may not have all the symptoms that I already told you about. So likewise, infertility is also one of the symptoms. So patient may or may not have infertility related to polycystic ovarian syndrome. So when a person has a diagnosis like PCOS, it doesn't mean that she cannot conceive without medications. But yes, it is one of the most important treatable causes for infertility. Because polycystic ovarian syndrome can cause anovulation. Person may not ovulate regularly, and her cycles are irregular. So we cannot actually time and tell her when she would be ovulating, so that she can time intercourse accordingly. So these are the main, and also the quality of eggs that is diminished in a case of PCOS because of the higher levels of male hormones, that is testosterone levels.
Yeah. Right. So when clients sign up for us for our programs online, and they are already having PCOD, and their doctor would have advised them a medication. So they do come to us. A very common question is that they are given Metformin tablet, which is basically a diabetes medication. So does it mean that they are diabetic, or does it mean that they are more prone to diabetic? You did mention about the insulin resistance. Could you kind of break it down in simple languages for our audience to understand why is metformin given and how is it related to the insulin resistance?
The main reason for symptoms in PCOS is hormonal imbalance. So that main hormonal fluctuations that we see is, one is insulin resistance, and second is increased level of male hormones. So this insulin resistance basically means that your body is producing insulin, but it is not actually acting at the level of receptors where it should be acting. So as a consequence, body tries and produces more insulin. So that is why you have higher levels of insulin in the body, but it is not actually acting where it should act. So then what happens is more and more of this glucose is converted into fat. So that is why people become obese, and they gain rapid resistance. So since the basic pathology of and insulin resistance is also the reason why testosterone levels are higher in a patient with polycystic ovaries. So since the basic pathology is insulin resistance, the treatment also involves giving metformin. Metformin is, although it is given as an anti-diabetic drug, it the mechanism of action is again stopping the insulin resistance in a patient's body. So that is why it is given in polycystic ovarian patients. Right. But it doesn't mean that because you're taking metformin, you will become diabetic. But as it is, polycystic ovarian syndrome has a lot of long-term implications. And one of it is that you will have a tendency to become diabetic after the age of 40. So around 10% of people with PCOS will become diabetic in future, and also around 30% will be pre-diabetic. So yeah, that is the reason why metformin is given.
Right. Yeah. Yet another very common question which is asked, more of a concern rather, from unmarried girls who come for our programs, is that sometimes they are given birth control pills as also part of the controlling this, and they are very skeptical of having that because they are not married. So they think that, is it safe to have it? Is it right to have it? Could you break it down for them?
Yeah, that is one of the main concerns that we have to address when people come to our OP also. So the reason why we give oral contraceptives or OCPs is because when a patient is not menstruating, say for 2 months and 3 months, the uterine lining keeps building up. So that has that makes a person more prone for having endometrial cancer in future.
Mm-hmm.
So we want her to shed the endometrium every month, or at least in every 2 months.
Mm.
And that is the reason why
Endometrium is the lining of the uterus.
Lining of the uterus, yeah. So that is the reason why OCPs are prescribed. But yeah, people have concerns regarding their excessive weight gain with use of oral contraceptives, and even people ask us questions like, will I get cancer if I use this oral contraceptive pills? So let me tell you that the newer generation OCPs are very safe and very effective.
Mm-hmm.
And most of these OCPs do not cause weight gain. In fact, it helps in weight loss, and it also helps with other symptoms of polycystic ovaries like hirsutism and acne. You can see that when a patient starts taking OCPs, their skin gets clearer, and even new excess hair growth is reduced with the use of oral contraceptive pills. But yes, she can have short-term side effects like nausea, bloating, breast tenderness. These are the usual common adverse effects that she can have, but that also will eventually settle, say within 2 or 3 months of usage of OCPs.
Right. What is the role of a lifestyle change, especially going on a diet, planning your calories and exercises when it comes to managing PCOD over a longer duration? Once a tablet is started, does that person have to be on that medication for rest of the life?
Basically, PCOS is a lifestyle disease. That is the reason why it is on the rise. Now, the incidence of polycystic ovaries is around 20% to anywhere around 40 to 50% in the reproductive age group. So, when we talk about treating PCOS, the first modality of treatment is always a lifestyle change that includes diet management and also exercise. We cannot just treat a patient with medications. Even talking about oral contraceptive pills or metformin, just putting a patient on metformin and oral contraceptive pills may not be a cure, because once you stop the medications, it can always recur back. So the most important modality will always be lifestyle changes, and like I said, diet and exercise. And even even a fall of say around 10% weight over 3 to 6 months can bring up her fertility levels by around 60%. So that is a huge difference, and a lot of people can be maintained without any medications if they strictly follow lifestyle modifications.
Right. And what is the chances of a PCOD reoccurrence once it is sorted with a lifestyle change and with this medication, and once the period cycle becomes normal and everything? Would it recur back again?
Let me tell you, PCOS is not actually a disease that can be cured. It is actually it is more of a disorder, that is more of a hormonal fluctuation that happens when a patient puts on weight. And it's like a vicious cycle. The more you put on weight, there is more tendency for you to have polycystic ovaries. And when you have PCOS, there is more tendency for you to put on weight. So it's like a vicious cycle which you need to break with weight loss. So it is not something curable, but it can always be kept under control
and managed.
Yeah, with medications and modifications. Once you stop these changes in your lifestyle changes, it can recur back. So again, that is something you have to keep in mind.
Right. So if a person who had a previous episode of PCOD just probably reversed it and wants to make sure that it doesn't reoccur again, is there a routine test or a blood test or a PCOD profile test that you would suggest that a person can do to kind of keep things under check periodically? If yes, what needs to be done?
There are blood tests to see if the levels of male hormones have increased, or if a person has insulin resistance. But that is not something that I would advise a patient to go to a lab and get it done. PCOS diagnosis moreover based on her symptoms and her weight gain. So it would not be advisable for someone to go to a lab and get it tested. Rather, they should have a regular checkup with their doctor.
How frequently should that be?
Yeah. See, since this condition also has long-term implications, it is always advisable that she goes to a doctor at least once a year and gets her glucose levels tested, blood sugars tested, her blood pressure checked, because she has a tendency to become hypertensive in future, and also get an ultrasound and look at the thickness of the uterus, uterine lining or endometrium.
Right.
So that is what would be advisable.
Right. One of the questions that we got is that does PCOD affect the quality of the egg or the size of the egg?
Yeah, it does. It does affect the quality of egg, in the sense that one is ovulation doesn't happen regularly in patients with PCOS. Second thing is, because of the higher levels of testosterone, the quality of egg would be poorer. So even if she is ovulating naturally, it may be difficult for her to conceive with PCOS condition.
Okay. A very relevant question that came to us is regarding, as a mother, if you have a girl child, what are the symptoms that one should be on lookout for to make sure that the girl child is not developing PCOD related issues? What are the things that you would have as an advice to mothers?
Yeah. Initial stages after a girl achieves menarche, say that for 2 years, she can have irregular cycles. So don't give it too much importance when, the initial 2 years when she has menstrual irregularities. But if it persists beyond that, and also if you see that your girl child is putting on weight rapidly or is obese, and sometimes she can also have mood fluctuations, and she has excess of acne and excess hair, and even darkening of skin around her the nape of neck and the axillary region or underarms. Then you should be cautious and maybe take her for a checkup and see what is to be done. Yeah, the main thing that you can do to avoid PCOS is make sure that she doesn't put on too much weight, make sure that the child is active, physically active. That is something that we often see that is lacking these days.
Right.
So that is what you need to make sure, and give her healthy food, and
A very interesting question, very relevant to the current pandemic which is going on. Not sure if it is related to PCOD, but then someone has asked that apparently this person had the homeopathic thing for coronavirus prevention, the prophylactic thing, arsenic album 30, and apparently missed periods. Any relation to this with PCOD, or anything that you can, any information that you can throw on this?
RSAL 30 is generally considered very safe across all age groups, and even for people with health conditions. But it may not be because of the medication as such, but yeah, stress levels have a very important role to play in your menstrual cycle regularity. So if a person is under stress, or if she has had a recent travel or recent weight gain because she's been sitting at home, that could have definitely caused.
Which mostly could have been the reason, considering that everybody is
yeah.
stressed and the activity levels have plummeted.
Yeah.
Right.
Yeah.
Another question is that the person had hair loss due to PCOD, and the dermatologist recommended minoxidil, Mintop, but that apparently caused more facial hair. So you try to get one sorted, the other one goes for a toss. What, any inputs or advice on that side?
Yeah, somebody with PCOS can have male pattern baldness, and Mintop or minoxidil is the most common topical medication that is usually prescribed by dermatologists. But this causing hirsutism on the face is not very likely, because topical application doesn't usually cause so much of absorption into the systemic circulation. So that may not be a reason why it's happening. But yes, if she has hirsutism otherwise, she needs to be treated for it accordingly. Maybe put on OC pills, or go for undergo laser treatment, or even there are topical applications available for hirsutism, ointments available which can be used.
Yes.
That will reduce the rate of growth of hair, but it will not remove the hair that is already present.
Right. If a person is having PCOD and if is on a metformin medication, will that metformin help in weight loss? That's another question which came in.
It will help in weight loss to a certain extent, because the moment your insulin resistance comes down, you will have some amount of weight loss along with it. But that is not a medication given per se for weight loss.
Yeah.
The main thing that you need to do is, make sure that you have regular exercise regime and diet changes.
Right, right. How can I calculate my ovulation day? My cycle varies from 30 to 40 days. Yet another question which came to us.
It is very difficult to calculate ovulation in a person who has irregular cycles. Generally, in a person who is regularly ovulating, ovulation would be somewhere around the 14th day. That is, if your cycles are, say, 28 day cycle, then 28 minus 14 would be the day you are ovulating. But unfortunately, in patients with PCO, we cannot exactly time and say that this is when you're ovulating. But there are some other modalities available through which you can actually check and see if you're ovulating regularly. One is ovulation kits that are available over the counter. So you can get a kit and start testing yourself, say somewhere from 10th or 11th day of your cycles, and keep checking it every alternate day. And second thing would be going for an ultrasound on alternate days. That is usually done when somebody undergoes fertility treatment. So we keep monitoring and tracking the follicle every alternate day from, say, day 10 or 11. And there are also some body changes that can happen when a person is ovulating. That is, her body temperature may be slightly higher than her usual temperature around the time of her ovulation. And even the consistency of vaginal discharge may be different in a person who's ovulating. It will become more of egg-like, and then slowly, gradually, it becomes thicker once a person is ovulated. Okay. So rather than going for such ovulatory kits and all that, what you can do is maybe try conceiving from days on alternate days from day 10 to, say, day 20 or 21 in a person who has irregular long cycles.
Right. So that takes us to the last question. When it comes to nutrition, what are some tips that you can give? And also regarding exercises, is there any? So, we keep telling our clients that not every exercise is meant for everyone. Don't just go in and lift weights if you're having piles. If you're having an arthritic knee, don't go and start running. You need to do
Exactly. Yeah.
exercises depending upon your body's physical ability and conditions. Similarly, for the diet also, we just don't say that stop eating, don't do a keto. If you are having uric acid or having a CKD or some sort of these kind of issues, then it can actually, or gallbladder stones, can actually make things worse. So with all these parameters taken care, especially a lot of fad diets, right from egg diet to water diet to GM diet to keto diet to whatnot goes on. So could you give some advice on when it comes to nutrition, what needs to be taken care, and if any tips on the exercise parts also that you can give us?
Um, First advice would be don't go for crash diets that will help you lose weight immediately, but then that is something that you cannot follow over a long term. And then, say in another 2-3 months, you put on that weight back. So first thing would be do not go for any crash diets. Second thing is maintain a balanced diet and make sure that you have foods with low glycemic index. And another thing that we have noticed is children or adolescents that take more of milk and milk products are more prone for developing acne and PCOS and menstrual irregularities and weight gain. So I would advise that cut down on your milk and milk products and excessive sugars in your diet. So that is regarding the diet part.
What
And
about chicken? What about poultry, chicken? Is that a cause?
yeah, that is again another very controversial question,
Disputed. Right.
because yeah. But yeah, generally we do advise the patient to cut down on eating poultry, because what we have noticed is the recent trend in the PCOS rise is because of the food habits, and the main thing is poultry and milk products. So
That
we
is definitely
generally advise not
right.
to take too
Right.
much.
Right. You were just about to talk about the exercises.
Yeah, and exercises are there are certain guidelines that we follow when we advise exercise to the patients. So what we say is at least 30 minutes of um, moderate exercise every day, or 20 minutes of vigorous exercise on alternate days, along with the muscle training, is what we advise the patients. And especially youngsters, adolescents, make sure that you're physically very active.
Mm.
Uh, you know, and it can be anything. It can be anything that the patient is able to follow in the long term, like say aerobics, Zumba, whatever suits them. But yeah, they need to make sure that they're physically active.
Right, right. Thanks a ton, Dr. Matuja, for coming in and talking to our audience. And when you were talking about the physical activity, rather physical inactivity, something very interesting that I just read in a Lancet journal is that apparently the lack of physical activity is as dangerous as smoking. It was a recent journal which came up there, which kind of correlates the diseases and the issues which is caused, and the percentage of people gets affected because of smoking and lack of physical activity are nearly the same. Very interesting thought. So to sum up, you mentioned that PCOD is in fact quite a lot related to lifestyle disorders, the lifestyle itself, and the long term method to actually get this arrested and get this under control is by lifestyle change. Medications do play a very important role, but then that needs to be done along with a lifestyle change. Only
Along
then
with
you can
you, that's right.
have it cured for rest of the life. Thanks a ton once again, doctor, for coming in.
Another thing I would just like to add is most of these patients with PCOS are obese, and they have body image issue. And also what we see is they are more prone for conditions like depression and mood swings.
Right.
So exercise definitely helps in in those conditions also. So release of endorphins itself will,
Yeah, the neurotransmitter
help
makes you feel
them
good.
fight
Yeah.
depression and mood
Right,
swings.
right.
Yeah.
So I'm sorry, that also brings me to the one more question that immediately popped up in my head. I see a lot of people vitamin D deficient. Is there
Yeah.
any relation with that with PCOD? Is there a correlation with vitamin D?
So far, it is. See, like I told you, we've not been able to
Conclusively
find out an
proven.
exact cause why some people have PCOS. But yeah, that there is also, we've also found an association with the vitamin D deficiency with PCOS. Yeah.
Right.
Although nothing's come out conclusively.
Conclusively. Right, right. Very interesting and insightful discussion. Thanks a ton once again for coming to us. That was Dr. Madhuja for you. She is the specialist obstetrics, gynecology, and minimal access surgery at the Rene Medicity in Cochin. She's also available for virtual and telephonic consultations. You know what needs to be done. If you need to do that, reach out to us from our website, NuvoVivo.com, NuvoVivo.com. We would guide that further details and would connect you to Dr. Madhuja. We are an online health, wellness, and fitness company. We not only make you look good, but also manage lifestyle disorders, which in turn require a lifestyle change itself. And we work with our clients across the globe. So we'll be there to help you with whatever requirements that you would need. Thank you once again, Dr. Madhuja, for coming in and sharing all your
Thank you.
insightful information. Thank you. Bye.